Hello, everyone, and welcome to our Advisory Council for Victims of Crime meeting. I'm going to get us started today with some introductions, and then we have a pretty robust schedule for the day, so I want to make sure that both our presenters today have adequate time to cover the topics that they will be covering with us today. So I'm Yvette Young. I'm one of the co-chairs for the Advisory Council, and I'm going to toss it to Laura so she can introduce herself, and then we'll ask each of you to do the same.
Good afternoon. I'm Laura Baldini. I am fortunate to co-chair this council with Yvette Young. I sit in New Britain, in the New Britain Judicial District.
Thanks, Laura. Irene, I'll just call folks' names as I see them.
Hello, my name is Irene Michael. I'm delighted to be here today. I hope you all can see my face. I have missed you all. I've usually attended by phone, but today I'm with my daughter and she set this whole thing up, and I'm just delighted to see everyone. Irene Michael from the Office of Victim Services.
Welcome. Debbie?
Hi, I'm Debbie Whitkin. I'm the Executive Director of Connecticut Legal Services, and nice to see everybody.
Thanks, Debbie. Mark?
Good afternoon, everyone. Mark Pelka, Office of Policy Management, Criminal Justice Policy and Planning Division Undersecretary. Great to be with you all today and looking forward to the presentations and discussion.
Thanks, Mike. Lee?
Good afternoon, everybody. I'm Lee Ross. I'm the Deputy Director for Legislative Affairs for the branch.
Thanks, Lee. Mary?
Good afternoon, everyone. Mary Kazicki, Deputy Director with the Office of Victim Services. Nice to see everyone.
Thanks, Mary. Crystal?
Hi, everyone. Crystal Rich with the Connecticut Children's Alliance. Thanks for having me today.
Thanks, Crystal. Siobhan?
Hi, everybody. Nice to meet you all. I'm Siobhan Campbell. I'm the Compliance Director for Hartford Communities That Care.
Welcome. James?
Good afternoon, everyone. I'm Jim Morgan, Program Manager at the Office of Victim Services.
Thanks, James. Andrew?
Hello, everyone. Andrew Woods, Executive Director of Hartford Communities That Care. Glad to be here.
Thanks, Andrew. Kanisha?
Good afternoon, everyone. Keisha Farquharson, the Deputy Director at the Connecticut Alliance and Sexual Violence.
Welcome. Jane, do you want to introduce yourself?
Hi, everyone. Jean Weisbrod with the Office of Victim Services. I provide the administrative support.
Excellent. Okay, Jean, one last thing before you mute. Do we have quorum to do the approval of the February 14th meeting?
It looks like we have 7 members present. Jerry Wild will be joining us in about 15 minutes. That'll give us 8. And we are still waiting for Susan O'Malley to join. So could we wait a couple of minutes?
Yeah, sure. I was going to say we can wait till the end and do that piece then. All right, excellent. So we're going to bypass the approval of the February 14 meeting minutes. We'll get back to that before we close out for today. So now we have our first presentation for the afternoon, which is going to be done by Crystal Rich. And she's going to be sharing with us information about the Regionalized Human Trafficking Recovery Task Force, which is out of Hartford and covers some of the surrounding towns. She'll go in depth with what that particular task force is working on and then be available to answer any questions that you may have in regards to the topic. So Crystal, you're up.
Thanks. Am I able to share my screen?
You should be able to, right, Jean?
Yes, I made the addiction that she's a presenter.
Okay, can everyone see that?
I can, yeah.
Yep.
Great. Well, thanks again for having me. I appreciate it. And Charmise apologizes. She wishes she could be here as well. So again, Crystal Rich, I'm with the Connecticut Children's Alliance. And for those of you who don't know, that is the state's coalition for child advocacy centers and multidisciplinary teams focused on the response to child abuse. Today, I'm here to talk about a new project that we are working on with the Hartford State's Attorney's Office called the Regionalized Human Trafficking Recovery Task Force. So today I'm just going to go over our mission, a little bit about our why, how we developed, some of the current data and trends that we're seeing as we've been actually seeing some cases, and then some of our next steps. And I'm happy to take questions along the way as well. So the Regionalized Human Trafficking Recovery Task Force, RHTRT, which I know is a mouthful, our mission is to end human trafficking in the greater Hartford region through a multidisciplinary response to both sex and labor trafficking cases. The cases that we are seeing are both child and adult victims, and again, of sex and labor. We cover 8 towns, so we cover Hartford, West Hartford, Bloomfield, South Windsor, Manchester, East Hartford, Glastonbury, and Windsor. Before I get into the why, just a quick little history of how we came to be. So the Office of Victims of Crime on the federal level put out a RFP to develop a task force. So I think they fund about 8 or 9 each year specific to responding to human trafficking. And so Sharmise and I got together, having been really privy to seeing some of the needs, especially in the Hartford region, and decided to go for the specific grant. So I'll get into a little bit about kind of some of the information that we were seeing in our particular roles that got us there. So we know that, and I won't go over these specific stats, but we know human trafficking is a huge issue. I think over the course of the last decade or so, we've really started to identify the fact that it's not just an international issue, but it's a domestic problem, and it certainly exists in the state of Connecticut. We do have a lot of issues in terms of data collection. I think that has to do a lot with how we all collect data very differently, along with the identification of some of these victims, but we certainly know that it is a big problem, and Connecticut is not immune. So as I mentioned, the Connecticut Children's Alliance is a coalition for multidisciplinary teams. So just a brief overview of what that is for those of you who don't know. We have 17 teams across the state that respond to child abuse. So what they do is it's law enforcement, prosecution, DCF workers, medical providers, mental health advocacy, and specialized interviewers. And they work on providing a comprehensive response to child abuse victims in their area. They serve sexual abuse victims, severe physical abuse, occasionally neglect cases. And then in 2014, our legislation changed and our multidisciplinary teams began seeing human trafficking cases or child trafficking cases. In 2014, when that changed, our MDT saw only a few cases, around 9. Upwards, we moved forward to 2022, and statewide, we saw around 92 cases. We still know that's really low in comparison to the prevalence that we know is out there, but we are working on identifying those cases more readily and being able to respond. Through the response to our MDTs, we learned a lot, right? So we learned that although the multidisciplinary team response is really helpful for these cases are a lot more time intensive than some of the other cases we had historically been seeing. We also realized that there was a lack of specialized resources. Though we have some great providers in the state working with trafficking victims, there's still a huge need for additional resources. And again, there was just a need to really focus in and make sure that there was a specialized response to these victims. The other thing that we realized, and Sharmise and I in the development of this task force kind of talked about, is that although we're really fortunate to have this multidisciplinary response to child abuse cases, there is no response like this for adult victimization, period. So when this grant came available, we decided what we would do is develop a specialized response to enhance the response we already had for child trafficking, but then also develop a pilot where we could use that multidisciplinary approach to respond to adult victims of trafficking. So this is kind of our development and how it works. Again, we partnered with the Hartford State's Attorney's Office, who focuses on the law enforcement prosecution side. And then we serve as the victim service lead, partnering with our multidisciplinary teams in this region. What we ended up doing through the grant is we hired a coordinator. So we have a specialized coordinator who works with all of our partners to team these cases. And we also have our own victim advocate who tries to provide the victim service response to every client that we see. We have 5 main objectives as a task force. So one is to establish and sustain effective leadership and a structure that will support the goals of the task force, which, as I mentioned earlier, is really to respond and end trafficking in the greater Hartford region. Making data-driven decisions based on shared understanding of the prevalence, scope, and nature of human trafficking. So we really are trying to focus a lot on collecting that data and being responsive to what we're seeing. Identifying victims of all types of human trafficking through coordinated training, public awareness, and outreach. So again, I mentioned earlier that the cases that we were seeing are both sex and labor trafficking. I will say, and I think this is across the nation, but certainly in Connecticut, we do know a lot more about sex trafficking and really have to do a lot more work around labor trafficking, understanding how to identify those victims and provide those services. So that's part of one of our core objectives. Conduct proactive investigations of sex and labor trafficking with the goal of successful prosecution at the level appropriate to each case. So keyword here being proactive, really trying to identify some of those red flags, get involved in cases earlier on before things get to another level. And we're really trying to take in community tips, working with law enforcement, working with a lot of our community providers, so that again, we don't wait until there's been so many missed reports that someone's been victimized for a long period of time. And then ensure a comprehensive array of services are readily available. One of the things that I'll talk a lot about actually through this presentation is the need for more comprehensive services. That's one of our objectives as well. This is the structure of our task force. So you'll see the executive committee task force oversight. So that would be myself and the state's attorney, along with our coordinator. We also have a dedicated law enforcement lead that's actually out of the Manchester Police Department. So he really helps us kind of triage the cases and work to identify the appropriate law enforcement that's going to respond. And we have this sectioned out in a couple of different ways. So we have a response team, which is actually the team of individuals that is going to provide the response to the identified cases that we see. And then we also have an oversight council that really helps provide us with that kind of guidance and looks at the policy, the operation manuals, all the trainings that we're going to do. And that council's membership is very diverse. So we try to invite a lot of our partners who are already doing the work onto this task force, both from the victim service side as well as the law enforcement and prosecution side. So our response team, as I mentioned, that is the team that responds to the actual cases. We have 2 tracks within that. One, we have what we call the full team response. And so that's when we've identified a case where there is, we've identified a certain level of criminality where law enforcement can in fact respond. What we're seeing happen with a lot of these cases is we'll get information that there's identified red flags with a particular victim. We know, we have an idea that someone's been trafficked, but there's just not enough information for law enforcement to respond. So we wanted to make sure we also had a separate track where we could allow our victim advocate to start working with those identified folks, trying to build that rapport, trying to offer them services. Some of the folks that we've identified that, again, have some of those red flags may not be ready to come forward. They may not identify themselves yet as a victim, but we want to make sure that they're provided with the support that they need, in hopes that eventually they may come forward and get the additional, supports, and we can go for a full team response. So we have those 2 kind of tracks. As I mentioned earlier, our response team members include dedicated law enforcement from the following police departments. One of the things that's really great about this grant and about this project is that our law enforcement in those particular areas, all of the chiefs have identified a dedicated detective within that department that we can train up to work on these cases. And one of the things that we found is really helpful is when someone has that specialized training. It just makes the whole process go a lot smoother and provides a much better, more comprehensive response for our victims. So we're really thankful for the chiefs in those departments who were able to do that. We also have our coordinator and, again, our advocate. Our council, as I mentioned, is made up of a diverse group of folks who do this work. We also have a couple of subcommittees that will help guide the work. We are currently in the process of bringing those to fruition. So we'll have a training and awareness committee really focused in developing Connecticut-specific training, as well as raising awareness within the communities. Service delivery, as I mentioned, one of the biggest gaps in terms of resources is having those specialized services available. So we're bringing together a committee of folks who work with trafficking victims currently to identify where are the gaps, what services do we still need. And then we actually have your co-chair, Yvette Young, is our chair for our Racial Justice and Cultural Considerations Committee. And we are very thankful to her for that. One of the things that Sharmise and I talked a lot about in the development of this is making sure that as we were developing our response and everything we do as this task force, that we're looking through all the things that we develop through a racial justice lens, recognizing that a disproportionate number of the victims that we're serving are coming from minority groups. And we want to make sure that we are considering, we are looking at all those cultural considerations and really talking about the racism that exists within the response. So the benefits of this task force, or this regionalized model, again, multiple sources of information. We're serving really as a centralized hub, taking in some of these referrals from both law enforcement, DCF, community providers, and taking all of those tidbits and hoping to pull together cases because of that. One of the things that we saw prior to this is there's a lot of silos, right? So DCF might get some information, but that's not necessarily being shared with other community providers. Or you might have a community provider that is engaging with these victims, but not really trained up to really know how to get that information to law enforcement or DCF. So we're really trying to bridge some of those gaps. Developing a better understanding of what the needs are, really trying to make sure that everything that we do is through a victim-centered and trauma-informed lens. And then because we're doing this as a pilot, we're allowing ourselves to develop and change as we learn more. One of the issues, or one of the benefits, I should say, coming from that lens of this grant is that they are allowing us to shift and tweak things as we better understand the needs of the population. Victim services and law enforcement collaboration. One of the great things, again, about this process is when we hired our victim advocate and developed the law enforcement component, one of the things that we're doing is making sure that our victim advocate is always partnering with our law enforcement. So by that, I mean, whenever possible, when law enforcement is going out to identify a victim or talk to a victim, that there is that advocate there to really bridge that gap and make sure that all of those interactions are coming from the victim-centered process. I mentioned the specialized law enforcement. So current data and trends. So this is just a little bit about the cases that we've seen so far. So we officially launched on the 25th of January. Since then, we've seen 23 cases, 10 cases receiving a full task force response. And as I mentioned earlier, that's the response where our law enforcement and victim service partners are involved. 13 of the 23 cases are currently receiving services only, although we did have a recent case that transitioned from services only to a full task force response just this week. And on here, we have 2 cases involving community tips with multiple victims. So as we're gaining more traction and making more partnerships, we are getting more tips from the community and different providers. So just a little bit from our referral sources. So you'll see, some of the referrals are coming from police departments and direct reports into them. A lot of them are coming, when you see court or DCJ, those are the 737. Many of them are the 737s that are being sent from DCF, but others are notifications that are being sent to the court. Little data on kind of our breakout. So initially, I will say the first couple of weeks or the first month or so that we started receiving cases, the majority of those cases were child referrals. A lot of that just has to do with, our backgrounds and certainly that multidisciplinary process has existed for a long time for the child cases. But we have quickly started to see a lot more adult cases. Spanning a lot of ages, but I would say the vast majority of the adult cases are between that 18 and 25 range. So just a little bit of breakdown in terms of where we're seeing some of the cases from the active law enforcement partners. And I think I mentioned this earlier, but one of the things that's been really helpful is that even though you'll see, a vast majority of these cases have been referred that are occurring are in Hartford. But what's great is that the detectives in all of the other towns are able to help and assist when there's cases in each other's jurisdiction. So For example, we had a missing children's case that also had trafficking components about a month ago. And 4 different detectives from 4 different towns were able to help each other on that case. We also partnered with New York State, and we were able to actually identify the 2 missing youths within a couple of days, which was really great. A little bit about some of our early successes. So again, we're only a couple of months in, but we've really identified or seen how helpful it is to have this very specialized response for these cases. We're able to, because of the resources, able to respond a lot quicker, which we know with a lot of trafficking situations, it's very hard to have long-term engagement with these survivors and victims. You know, there's a lot of mistrust with the system. There's often, you know, multiple times running back to the life before they end up getting out. And so being able to respond in a timely fashion is really very critical. Again, I mentioned the dedicated law enforcement and that sharing of those resources. So for our areas that are overwhelmed with these cases, they are able to pull on their partners from other towns. Advocate and law enforcement collaboration, like I mentioned, making sure that those interactions for our victims are trauma informed and victim centered on the onset. Collaboration with existing resources. So one of the things we've also been realizing as we've over the last couple of months is the opportunity to really work collaboratively with some of the resources that already exist and help train them up to work specifically with the trafficking population. And I know Kenesha's on this call right now. One of our current collaborations and biggest successes is we are working with the Connecticut Alliance to End Sexual Violence to help train up their hotline staff in trafficking so that they can start to see some of those referrals through their 24-hour hotline. And we're trying to identify ways where we don't necessarily have to reinvent the wheel and utilize our partners in the field. Development of a comprehensive resource guide. One of our victim advocate and our coordinator have been working tirelessly to develop a resource guide and identify those resources that are out there. Certainly partners that are working specifically within the trafficking field, but also partners that offer resources to meet our victims' basic needs. You know, we know for a lot of our victims, they're not going to engage in, trauma-informed therapy if they don't have housing or they don't have food or they don't have some of those basic needs met, right? So we know that it's a spectrum of those services, and we're trying to make sure that we build that resource network and build those relationships. The other success, I would say, is the fact that we as a task force are trying to redefine what success looks like in this work. Historically, a lot of the focus has been on prosecutions. And for those of you who sit at some of the other tables, I'm sure you're familiar with this, that we talked a lot in the state about how there's very low prosecution numbers for trafficking cases. And while that's certainly important, and one of the goals of this task force is to increase the number of successful prosecutions, we are also looking to shift success to include client success. Some of the examples I have are, even already, we've had a victim who was very reluctant to work with law enforcement, and we actually had one of our detectives who was wonderful sit down with them and actually explain what the process looked like, what it looked like to participate in an investigation, what it meant to come forward with information and partner with law enforcement and prosecution. And it was an amazing experience for that victim and our advocate to really see, that sharing of information and how they made it less scary for that victim. A few of our survivors, we've been able to partner with some different organizations and get them involved in different interests like STEM, art programs, and even one of our survivors has enrolled in community college. Law enforcement from multiple jurisdictions. I mentioned that case earlier where we had the missing youth, and the fact that all of the law enforcement were able to come together, and we were able to partner with actually an existing task force in the state of New York, just resulted in a much quicker response, identifying those youth and getting them into the supports that they needed. We're seeing a lot more ongoing engagement in long-term services. I think having, the advocate connected that can build rapport, that ongoing rapport with the folks that we are identifying, allows them to feel more connected and be connected to a service that fits their needs. Engagement in school after a long period of being absent. We've had a couple of identified trafficked youth who were missing from school, not engaging in education. And 2 of them, in fact, have been going to school and reducing the number of days that when they are absent, they're going back a lot quicker. And then, as I mentioned earlier, and those of us who do this work know that there are a lot of instances where, especially with our youth population, they're going back and running away from their home and going back into the life multiple times. And in 2 of our cases, we were seeing for youth that were chronic runaways and going back into life and going back to their traffickers, we've seen a significant reduction in the number of times that they're running away. And when they do run away, the duration is a lot shorter, and they are reaching out to the advocate and their supports in their life. So again, just really trying to look at success from all different angles. And of course, to be remiss without acknowledging some of the challenges, some of which I acknowledged earlier in the presentation. Information silos continue to exist. I think we all are aware that even though Connecticut's a small state, we do definitely have a lot of silos. So we are working again with our partners to try to figure out a way to share information in a much more timely fashion while still understanding the different confidentialities and respecting those boundaries. The MDT approach, as I mentioned, it's been a little bit easier getting our partners to collaborate and kind of come to that collaborative table for the child cases, but it's just something new for the adult cases. We haven't historically done that, so there's definitely a little bit of a learning curve on that. Time intensive, as I mentioned, these cases take a lot of time. We're starting to see a lot of the cases that we're getting in, there's multiple victims being victimized by the same trafficker. There's multiple jurisdictions that are involved. So it just takes a lot of resources. And even with the dedicated resources we have, there's still just not enough. Connecticut doesn't really have any dedicated funding specifically allocated for trafficking services. Some other states do, and that's definitely a gap that we have in our state. There's certainly a need for additional outreach to diverse communities to understand both what the community's needs are and to make sure that we're shaping our services to meet those specific needs. Housing, I would say, is probably one of the greatest unmet needs that we have with this population. There's a limited number of options. There's a difficulty in accessing those available options. A lot of our victims, if we have time, where we're with them and we're trying to work with them on housing, the process to actually get them in takes so long that by the time we do that, it oftentimes is not, they've gone back to the life, or they're, trying to go somewhere for housing that's maybe not the safest option. The other barrier is victims in some of the early stages leaving are not necessarily ready to comply with some of the rules and expectations for existing housing services. So just one example of that is some of the housing services, that long-term housing services that are available will have the barrier that the victim has to not have any current substance abuse issues, which is something that we see quite a bit with a lot of the victims that we're interacting with. So that is, sometimes a barrier for accessing housing. Immigration support providers are, constantly saying that they're overwhelmed by the current need. The other thing that we're seeing just overall in terms of trying to identify trends and identify victims in general is the data collection. There really is no consistency across our state in terms of how all of us as providers collect data. And then you add that to how the different state agencies are collecting data and municipalities. There's just no standardized way of doing that. So it makes it much harder. We're comparing almost apples to oranges. And so for our specific project, we're really trying to work with our partners to make sure that we're utilizing similar definitions for the variables that we're collecting. And then prevention, really looking at the fact that investing in victim services across the board and victim and basic needs is really a form of prevention. We know that a lot of our trafficking victims have experienced more than one other type of form of violence before even entering the life of trafficking. And so if we can enhance the amount of services that we put towards those other service providers, we can in fact prevent trafficking before it even occurs. And then just some of our next steps. We want to continue enhancing our partnerships, activating our larger council and subcommittees, as I mentioned, continuing to identify training gaps and developing Connecticut-specific training. We've realized that although there's a lot, and there are some great trainings actually in Connecticut for trafficking, but there are still some gaps remaining, especially I would say on the adult side of things. And we know that when we make a training that fits how our system works in the state, it just is much better received. Training up existing resources, some of the examples that I mentioned earlier. I have in here in quotes a credentialing process. One of the things that we are trying to be really thoughtful about from the very beginning is making sure that we are providing certain level of training to all of the partners that we refer to or that we bring on our council. We want to make sure that anybody that's interfacing with the folks that we are identifying is well trained to provide services for them, making sure again that they're trauma informed, but also understand the dynamics of trafficking. We're working on formalizing our data collection, as I mentioned, and engaging in a formal evaluation process. We want to make sure that what we're doing is working. And we want to make sure that if there are tweaks that we need to make along the way, that we are catching those early on. Developing client and partner feedback surveys. So for all of our multidisciplinary teams across the state, we already have something called an outcome measurement system, which encompasses a variety of surveys for our clients, our caregivers, our youth, and our multidisciplinary partners that we utilize just to, again, on a regular basis, check in and see how we're doing if we need to make tweaks. And that is something that we are currently developing for the task force. And then work with our partners to assess Connecticut's needs. You know, as we're doing this work, we are certainly identifying some great, amazing resources that I think not everyone realizes are even there, and then also identifying some of those gaps. So we would love to, over the next remainder of 2023, bring together some of the partners in this work and almost look at creating a quasi needs assessment / strategic plan. You know, how do we create a successful system in our state to respond to trafficking and also work on preventing it before it occurs? And these are just, you know, thanks. We have several more recent partners that we've added that are not on the list, but these are some of our amazing partners that have been helping us since, you know, even early on when we were writing the grant. And then that's it. Thank you. And I'll take any questions that anyone has.
I see a couple of hands up, Mark, and then Debbie, then Mary.
Thank you, Madam Chair. I appreciate it. Thank you very much for the presentation. It was very helpful and very impressive to see the array of partners that you have and the data that you're collecting. I was wondering if you had thoughts on what drives the human supply of trafficking victims. I was trying to picture how to get to the root of the matter and to how survivors and victims wind up being taken advantage of by the traffickers. Is there, you know, generally, is the problem be broken down to a relatively manageable number of people who engage in trafficking? Is it more one-to-one? If you were to try to, you know, break apart the individuals who carry out the trafficking, what's the design in terms of interrupting that flow and averting or preventing trafficking from happening?
No, those are great questions. And I think, you know, some we have some of the answers to and some we don't, in full honesty. To one of the questions that you asked in terms of like the one, you know, how many, is it a one-to-one? I would say the vast majority of what we're seeing, you know, traffickers usually have a number of victims. Very rarely have we seen, you know, kind of that one-to-one ratio, although I'm sure it exists. Even in the cases where we've maybe identified one victim, we know that there are most likely others out there that we just have not been able to identify. Yeah. I think it's certainly, there's that demand side, but there's also this, you know, as I mentioned earlier, I think one of the ways we can make the biggest impact is by looking at it from a prevention lens and making sure that we are providing resources and responding appropriately to other types of victimizations. I think it goes back to childhood, right? Making sure that kids have what they need to have a healthy childhood, that they're not victimized in other ways. Just anecdotally, some of the data that we've looked at, both as a coalition, the child side of things, as well as some of the cases that we've seen recently on the task force, I would say over 60 some odd % have identified that they've been victimized prior to being trafficked. So a lot of times they were sexually abused as children or physically abused, had sexual assaults as adults long before they became a trafficking victim. So I think, again, if we can intervene in that way as well, that'll make a huge difference.
It's very helpful. I think you mentioned some demographic information earlier. Do you have information about trafficking victims within Hartford or the region that you serve who are undocumented, or their sort of immigration status in general? Again, I'm just trying to get a kind of a grasp of the population of victims and survivors.
Yep, absolutely. So we are actually working on drilling down a little bit more on our data. So we haven't laid out, the exact demographics, but we have had, I would say, out of the 23 cases, we've had at least 5 or 6 that had immigration issues that they needed support on. So just from that initial kind of what we're looking at, that's what we're seeing so far. And again, part of the issue is that barrier in resources and the wait times to get some of those supports.
Thank you. And final thing, Madam Chair, is just to say that I was fortunate to receive a training from the Alliance to End Sexual Violence, the New Britain office on advocacy under the CAT class, and there is a detailed section provided to students on recognizing survivors of trafficking. And it was very helpful to me to gain greater clarity around how to recognize some of the patterns, and I credit the program with that. And final is I did speak with the Mohegan tribal nation recently, and the individual described training provided to a large number of casino staff regarding also recognizing someone who may be being trafficked. And it's, from what I understood, it was very helpful to the staff to recognize, at least look out for some of the patterns and know steps they could be taken. And I was moved by that, about the potential of being an advocate, in an area, just with that training, being aware and noticing. So forgive me for the length of my question and comments, but I really enjoyed the presentation, and thank you, Madam Chair.
Thanks, Mark. Debbie, you were next, and then Mary.
Thank you. So this is wonderful, and thank you. Mark asked one of my questions, so the only thing that I think I will ask is just if you're tied into the legal aid community at all, because Quinnipiac Clinic in Sheila Hare does this kind of work, and Greater Hartford Legal Aid covers most of the geographic area you talked about, but I know here at Connecticut Legal Services, we often have had clients who were victims of trafficking, and it would be wonderful to make sure that we're tied in so that if they need help with ancillary issues with getting benefits or getting medical care, or the god-awful mess of housing that we have, that we're working together on that. Thank you.
Absolutely. So we are partnering with legal aid, but that would be a great connection to make. Again, as we are identifying, one of the other things that we're doing in terms of identifying resources is working with different providers. So we have a couple of even dentists that are willing to give like free dental care to survivors. We are working with, trying to increase the amount of resources because we know that there are gaps there. So we're certainly willing to share some of that information. But yes, we have been working closely with the legal aid in our jurisdiction.
Mary, thank you, Deb.
Thanks, Yvette. And Crystal, thank you so much for the presentation. This was a wonderful presentation. And Mark did ask one of my follow-up questions as well around the prior victimization. That just also resonated with me as well, and hearing such a significant number, that 60% identify previous victimization, that just really again speaks to our need as a victim service community to really make those connections when victimizations are occurring, and that connection to service that maybe can, as you said, lead to some prevention. I did have another question around the law enforcement piece that also is so encouraging to hear that you had such great response and connection from law enforcement. And in speaking about having dedicated law enforcement officers within the departments, I just missed exactly what you said, if that was a single point of contact or if that's a team of officers that are trained to then be available for response. I would just love to hear a little more about that. Thank you.
Absolutely. Good to see you, Mary. in all of the 8 departments, there is a dedicated detective who is on our response team. Now, when I say dedicated to, that doesn't mean, of course, we dedicate people to lots of things, right? It doesn't take away their everyday responsibilities. So they're not fully dedicated to the task force, but they are the person who is the one that we reach out to when we identify a case. We give them ongoing training, and they work very collaboratively with our advocates. When I mentioned that we have a law enforcement lead at the Manchester Police Department, his name is Chris, he's a sergeant over there, and he is charged with, so when we have a case that comes in, he works with that group of detectives to say, okay, say the case is in Hartford, and we have Meg is actually our detective out there, that's our identified person for the task force. Chris will work with Meg to identify other detectives that can come in and help from those other towns. And so we have a team, but it's kind of one person per town, though there are certainly other times where, you know, detectives within those different departments will help. It's just that's kind of the person that'll take the lead because they've received all that training.
Thanks so much, Crystal.
No problem.
Okay, I don't see any other hands up. So I want to say thank you so much, Crystal, for taking the time for presenting to us. If folks have questions after the fact, you can feel free to reach out to her directly. You can send me an email and I can connect you with her and Sharmise. But we appreciate the work that you guys are both doing through this task force.
Thank you, and thank you for having me.
Excellent. All right, so next on our agenda, we have legislative updates. I know that we had discussed in last month's meeting, not last month's, the February meeting, that we would reintroduce the legislative updates section of our agenda. So if anyone has any legislative updates they would like to share at this time before we move into our second presentation. Any updates? Jerry?
Good afternoon, everyone. Sorry, I was a few minutes late. Just 2 updates. We have 2 bills, Senate Bill 5, which looks to expand the GPS statewide for domestic violence, as well as prohibiting alimony being ordered in situations where the victim pay alimony when they have been the other party was charged and convicted with criminal attempt to commit murder, attempt to commit manslaughter, and a few other conviction charges. The other bill is Senate Bill 1118, and that's establishing a Division of Criminal Justice Response to Enhancement Advisory Council. We're hoping, I know Crystal mentioned as far as kind of working in silos, and this is an attempt to bring different stakeholders out of the silos to come to the table and talk about the criminal justice response to domestic violence as a whole, looking at a wide range of topics, including the feasibility of dedicated domestic violence dockets across the state, the warrant procedures, both from law enforcement as well as once a warrant gets submitted to the court, violations of protective orders, and I'm trying to think of what else. Well, we are also looking at GPS, but because that's in Senate Bill 5, which is looking like it has a lot of traction, it may not be addressed in this council. But those are just some of the topics. And again, it's really to strengthen the response to domestic violence statewide. And I'm sorry, I have 2 little ones in the background.
Thanks, Jerry. Andrew?
Yeah, just briefly on that front, there's a coalition of folks with the Greater Hartford Interfaith Action Coalition that we're partnering with to get the state to actually make investments around $20 million to support violence prevention, intervention, treatment, and recovery programs specific to community violence across the state of Connecticut. So many of us are actually collaborating and working with each other to get lawmakers to buy into supporting these programs that we provide across the state.
Excellent, thanks. Mary?
Thank you, Yvette. I also just wanted to add the court operations bill this year includes language to expand access in juvenile and YO matters to a victim's next of kin to allow support to that victim in the court process or to attend in a victim's stead if the victim were to reside out of state or something along those lines. So that language is included in that bill as well, which I believe is Race Bill 6874.
Excellent. Anyone else? I would just say, if you do have legislation that you are supporting and you want any support or guidance from anyone on the council who can provide support or guidance or help with advocacy, to just reach out and let us know so that we can work as a collective, especially because, yet again, all of us are here focused on victims of crime. And even though we have our own particular subgroups that we work with, we do know that there's intersectionality that happens with the clients that we serve. So we should definitely see how we can use each other as support during this legislative process. All right. So before I turn it over to Judge Baldini, Jean, do we have quorum to do the vote on the minutes from February?
The count is at 9 right now, so it is a quorum.
Okay, excellent. So everyone, you received a copy of our February 14th meeting minutes. Hopefully you've had a chance to review it. Does anyone have any questions or edits before we do the final vote? Okay, so with no questions or discussion, I move that, actually I don't move. Could I have a motion to accept the February 14th, 2023 meeting minutes?
This is Debbie, so moved.
Second.
Judge Baldini, second.
Thank you. All in favor? Aye.
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 Anyone opposed? Any abstentions? Okay, motion passes. Thank you all. Judge Baldini.
Thank you. We're moving on to agenda item number 5. You should have received before today's meeting, in addition to the link that you clicked on, a file that will have Andrew Woods' presentation. I see he's here. Are you ready to present, Andrew?
Yes, I am. Yep.
Okay. The floor is yours.
Okay, great. See whether we got, should be able to share here. Okay. Okay, can folks see the screen?
Yes.
Okay, thank you very much. Okay, we have a few of our presenters, actually part of our staff that will also be a part of this presentation as well. And so Siobhan Campbell, who's on the call, as well as Johanna Schubert. And then we have staff members that are actually attending to other client matters at this time. So we'll cover some of their slides. But basically, HCTC, we've been around since 1998. This year we'll be celebrating 25 years in June. Based on the work that we've been doing here in the city of Hartford, but also across the greater Hartford area, and with some of our statewide efforts that you will hear more from Johanna on that as well. And so essentially what we have here, let me get to a full screen, is that the main program that we operated that is specifically VOCA funded is our Hartford Care Response Team, which is our hospital violence intervention program. And that particular program is led by Chanel Benjamin with a clinical case supervisor, Tasha Rose. And most recently, the city of Hartford also made investments in 2 additional hospitals over and above Trinity St. Francis, which includes Hartford Hospital as well as Children's Medical, and as well as 2 additional CBOs that are providing specifically HVIP work here in the city of Hartford. As it relates to the work that we've done since we've actually been funded by VOCA back in 2019, we've served over, and currently we actually use what's called the Penelope Case Management Software, to where we've, all of our clients are basically their information, their data, and the services that we provide is uploaded into this system, and that's how we manage our ability to provide them with the support and care that they need, they and their families. 524 individuals have been served since 2019. As you can see the breakdown there in terms of male, female, 175, 349 for males. And then of course you'll see the age ranges primarily of those that are impacted by violence here in the greater Hartford area. Typically folks just think Hartford Pacific, but really when you look at the hospitals they serve, New Britain, East Hartford, Manchester, Bloomfield, Weathersfield. These are where the victims of violent crime come from, in addition to the city of Hartford. What you notice here is just some of our collaborators. Again, the 3 major hospitals, also Hartford Behavioral Health, who is also a VOCA-funded program, Asylum Hill Family Medicine, and then we have other partners. Asylum Hill Medicine, they actually provide physicians that actually go into the homes of victims of violent crime and provide medical care in home. We also have our Harriet Home Health Care. They too, several years back, we started partnering with these institutions to go into the homes to do both wound care and physicals, and then route patients back to primary care as well as behavioral health care supports. Look at the demographically, again, the vast majority of victims that we've served, 266 by African Americans, 83 Hispanics, and then you can see the other breakdown among the other groups. Actually represents, something's freezing here. Okay, the next slide actually represents our service model. So typically what happens under our Hartford Care Response Team, our HVIP program, is that within the first hour, our staff, which includes intervention specialists and some of our case managers, they will respond to the hospital or to the crime scenes within 1 hour, basically building rapport with their families, the victim, if the victim is able to be seen bedside, the family, gathering information, developing an initial safety plan with that patient, that victim of violent crime, and then also making them aware of the VOCA services that we can provide them in terms of what's available to them and their family. Within 30 days, on average, around 15 to 20 hours of case management time is devoted towards each family member or each individual. And that includes completing consent forms, VOCA application, further flushing out the safety plan, and then also putting together a case management plan, advocacy and support, and referrals to other services. And again, when you look at case management services, typically, again, 15 to 20 hours on average per family. Within 60 days, you can see as the chart continues to progress, obviously the time commitment from our case managers begins to recede, which is what we want. And where you, on average, you'll have around 10 to 15 hours of case management support, clinical services, connection to employment, housing, criminal advocacy, criminal justice connections. And then it goes on to 90 days, 6 months, follow-up exit plan, mailing out surveys, connecting with families, seeing whether or not, and of course, along the way, we are connecting with families to see whether or not our services are of support to them. And although typically we like to close out a case after the first year or at the 1 year mark, the case is never ever really closed, because the nature of crime victims is that though we offer these services along the way of 30, 60, 90, 6-month mark, a victim may not or a family may not decide to take advantage of these services 30, 60, 90, a half a year or a year out, a year away. And that's typically because oftentimes some families just want to be left alone. Some individuals just want to be left alone because they're processing their victimization. They really just want to be safe. They want to be out of harm's way, which is safety. And they're trying to, again, process the impact the violent crime has had on them. And then eventually, over time, because of our continuous outreach, as well as their interest in recalling that we are there for them, they may reach back out to say, hey, listen, we want to take advantage of services.
Well, it looks like Mr. Wood's call got dropped. Hopefully he's able to jump back in.
Siobhan, do you have the PowerPoint by any chance? I think
Yeah, I'm
my
bringing it
slides are
up.
next.
Yeah, I'm bringing it up right now. Oh, okay. I see Mr. Woods hopping back on.
Oh, good. Uh-oh.
You know, I'm gonna move over to the oh, Mr. Woods comes on. I'm gonna move over to your section.
Okay. Terrific. Thanks. All right. Good afternoon, everyone. Thanks so much for having us. As Mr. Woods mentioned, my name is Johanna Schubert. I'm the director of the statewide Hospital Violence Intervention Program Collaborative here at Hartford Community SetCare. So a little bit about the collaborative. The statewide collaborative was formed in 2019 after a spike in violence brought together advocates and stakeholders from all over the state to talk about how we could better coordinate our efforts, both legislatively and within our institutions to better serve victims of violence. And you'll see in the slide there a couple of examples of how we are operationalizing that. So you can see that we have had a contract with the Urban Community Alliance in New Haven, where we helped their staff and executive team get connected to case management software. We helped them get connected to nationally certified training with our partners, the Health Alliance for Violence Intervention. And we gave guidance in terms of creating long and short-term goals to continue working under a best practices framework within hospital violence intervention. We have a contract now with Project Longevity, which has sites in New Haven, Hartford, Waterbury, and Bridgeport. And those folks are getting traction. They're getting their feet under them and building a network of stakeholders and communities. And we are helping them to understand the landscape of hospital violence intervention work across the state, as well as providing individual training sessions at each of their 4 program sites. So the idea of the Hospital Violence Intervention Program Collaborative, and one of the main goals of working as a statewide collaborative and as a team, is to make sure that any place in the state of Connecticut where you're injured and you become a victim of violence, that HVIP safety net is there for you, that those best practice models are being put into practice anywhere that you're injured. Next slide, please. Alrighty, so we are, in addition to serving those that we are working with directly under contracts, we are also becoming a go-to resource for policymakers looking for guidance. We recently were in Norwalk standing with the Lieutenant Governor to advocate for expansion of protections for those victims of domestic violence. And as recently as yesterday, we were supposed to host a roundtable discussion on violence prevention with Senator Blumenthal, but unfortunately, due to his injury, we were unable to do so, and that event is postponed. We have also had several members of our HVIP collaborative. They have been appointed to the statewide Commission on Community Violence Intervention and Prevention. And so our network of frontline experts are also active at the statewide level, helping to guide policy and focus resource towards violence prevention. And we're committed to building coalitions across the state of Connecticut, because we know that that is a dynamic way to move policy forward and to achieve both short-term and long-term goals. So we are, as Mr. Woods mentioned, building relationships with the Greater Hartford Interfaith Action Alliance. That's a network of over 50 diverse congregations across the religious spectrum who unite under an umbrella of social justice and come together to advocate for change. We're also collaborating with students from Yale University on a program that they are trying to launch. So again, we are really taking advantage of the idea of a collaborative. We know that strength comes from folks with different specialties and from different areas of the state. And we know that the more diverse representation we have, the more likely it is that we can make real change across the state. So thank you for listening.
Thank you. Thank you. Mr. Woods, are you back on?
Yes, I am. Yep. If you can keep the slides going, I'd appreciate that. Okay,
No problem.
thank you. Okay, one of the areas that that we wanted to make sure that we for dozens of years that we've been doing this work, it became clear to us when it came down to addressing violent crime among young people, especially young people that are school aged. And it always concerned us that we, one, didn't have the resources to actually go backwards and provide a lot of the more intensive engagement, case management support for young victims of violent crime who are inside our schools. For 5 years, the New Visions Alternative School here in the north end of Hartford, which actually serves citywide, had been lobbying us to come into that school to provide the prevention work for young people who were sent to this school, primarily young people who are victims of violent crime, who also may, in some cases, were perpetrating violent crime. Because of an earmark that we were able to get through Congressman Larson's office, we were finally able to go into this school, and actually as late as last year, and we officially launched this February, to where we hired up a director, case supervisors, case managers, and intervention specialists to specifically enhance, which is really our hospital link violence intervention program. But this New Visions program is an enhancement to serve more younger people who have been historically not connected to the kind of services that we knew could make a difference in terms of serving these young victims of violent crime. And so essentially, again, just this recently, as a few months ago, we hired up a full staffing for the program. Again, case management services, family and engagement services, making sure that we integrated into these programs one-on-one and group-based services for these young people, home visits, and street-level intervention services for those that attend this school, but also even when they go back to their school of origin, which many of them do, we also will be tracking them and making sure we continue to provide them the same level of care that we will provide others that we serve under our regular program, which is our Hospital Link Violence Intervention Program. This inclusion of school teachers, school personnel, behavioral staff, and really coordinating our services along with all of those individuals as well. Next slide. And so one of the directors that we actually hired is a young man, Liebert Lester, who's actually a Morehouse grad. Liebert is around 27 years old. And very sharp young man, has a strong clinical background. I think he's going for his actually PhD in clinical psychology. He is actually now the director of this program. He is a North Hartford kid who has a dad who has a barbershop here in the north end of Hartford. And he knows the population well, he knows the community well, and again, has a strong clinical background and a program background. And we felt that along with the other staff, that this person would be ideal to actually lead these efforts. So just as we're looking to build the capacity of this program, we're also looking to build the capacity of even those that work with this particular population. So Liebert actually decided to adopt as one of the strategies, this pairing the Breathe model. And if he were here, he can actually best describe this more than I can. But basically, it is a clinical approach to really looking at and addressing the trauma that young people have experienced, and really providing with the tools and expertise they need to actually be able to self-regulate and to be able to process information, process their own interactions with other people, and then come away from those with better ways of handling and coping with the daily stressors, as well as being able to reduce the likelihood that they would put themselves or find themselves in situations that landed them or got them to be referred to the school to begin with. Next slide. And then now we'll actually go over to Siobhan Campbell. Siobhan actually is more than not just the director of compliance, but also quality assurance. So we just recently brought Siobhan on. And really, when we wanted to bring Siobhan on, that one thing we lacked as an agency was really around the fact that we do have multiple funding sources. But in addition to that, beyond the fact that we got a few funding sources, we really want to make sure that from a quality standpoint, quality assurance standpoint, that we were providing the best quality care across all programs, across the agency, and then looking at ways that we can improve upon these services. And the investment in a compliance director, one with a background in quality assurance, was someone that we wanted to bring on board. Now, one of the areas that Siobhan will touch on is that I mentioned to Siobhan early on during his interview was that the VOCA, the victims of our VOCA agency, the state, put together last year and released last year and earlier this year that the needs assessment, the VOCA needs assessment. And I said, listen, one of the areas that we really want to hone in on is to make sure that we as an agency was doing everything we can to actually improve upon that needs assessment, really by looking at the gaps and looking at ways that by which we can build on, especially here in urban Hartford, ways that we can build on closing those gaps in services and improving services for victims of violent crime in our area. So Siobhan, I'm going to turn it over to you, and feel free to touch on a few of the other things that you're working on in addition to that.
Absolutely. Thank you, Mr. Woods. So we can look at the VOCA needs assessment. So there were a couple areas that stood out to us in terms of the gap. I know awareness of services was one of the big ones. Then also the services that were provided, and then how to improve the quality of it, but then also the services that were not provided and then some of the barriers. And so based off of the needs assessment, here were some of the recommendations that they gave. And on the right side of this diagram, you'll see kind of some of the HCTC's initiatives to meet some of these recommendations that came from the VOCA needs assessment. So again, awareness of services was probably one of the biggest things, at least from my reading, that came from that assessment. And we have a family and community engagement a team that's basically doing a lot of outreach, and we're actually going to have a slide on that coming up later, so I won't dive too deeply into it. But that's big on one terms of one of the recommendations was repetitively provide information, then increase communication with service providers. What came from the needs assessment is because of the trauma, even though you're telling clients about services, they might not remember it because they're trying to figure out what's the next step. So that's a big thing, is making sure that our family and community engagement team, we call it FACE, is doing multiple versions of outreach, but then also doing that in programs as well. That also falls in line with the business cards. I know in addition to purchasing the business cards, staff volunteers, they're going to receive new merchandise. So basically, we want to make sure people know us so that when things happen, they know who to reach out to. So again, more communication and more touches. And then hiring past victims and survivors was another recommendation. I know HCTC has increased the numbers of hires who are past victims and survivors, even from our New Visions program that Mr. Woods talked about. I love it because we're hiring people from the community, experts from the community, which makes all the difference. And that was shown up in the needs assessment as well. Then connecting to police to social care services. And that's one of the things we're trying to be as innovative as possible to build relationships with law enforcement as well as school resource officers, probation. And again, that speaks to our New Vision program, is we're trying to figure out creative ways to making sure we can reach people. So if it's going into schools, if it's working with law enforcement, we're trying to figure out what are the best way to get people connected to services. And then lastly, one of the other recommendations was trauma-informed service providers. And one of the things that we're doing and can continue to keep doing is to provide ongoing professional development for staff, making sure that they have access to regional and national conferences, and focusing on basically improving their ability and making sure they're getting the most recent training so they can come back and give the best quality service to our clients. And that was more from the VOCA needs assessment standpoint. I think, and I was grateful for that because it gave an overview of what's going on in Connecticut. But I know one of the things that HCTC cares about is like, what are our direct stakeholders feeling? What about the people that are directly affected, the Hartford community and beyond? And so the first thing we're trying to do is elicit ongoing feedback from stakeholders by providing a survey that they can take to figure out what are some of the gaps or areas of improvement that we can have. And so who we're going to be reaching out to is community members, local youth leadership, board members, external subject matter experts, and then staff. And that's going to be a great assessment that we're bringing out to them. It's mostly done already. I think one of the things that I love as well is we're giving the assessment to the youth so that they can clear up the language and make sure it's as clear as possible. So when the stakeholders are taking the assessment, they're not just combing through it, but they actually understand what we're asking of them. And then lastly, the areas we're going to use that assessment to refine and enhance our communication, program adaptability, and then who are the people that we need to partner with. So basically, everything the direction that we're going is very much in line with the needs assessment, and that's something that we are grateful for. And even with program adaptability, I know I'm coming up with a whole bunch of data metrics and project management tools to make sure that we're giving the best quality service that we can across each of our programs.
All right, thank you. Siobhan. So another young lady who's actually on board with us as well is Janika LeBron. She's actually leads some of our marketing and branding outreach and engagement effort, making sure that the staff has all the tools that they need, whether that's even in addition to social media, our web presence, in which Siobhan talked about business cards, but also our gear when we're tabling events at special events. So anytime something happens in the greater Hartford area, or as many things, so even if yourselves or any of you are partners on the call here, if you have an event, we would like to know about it, we like to learn about it, and we'd like to even have our staff come and set up a table, set up a booth, share information and share the kind of support that we provide to families at your event but any event that's going on. We want to hear about it because we want our staff out there at as many functions as possible to communicate the importance of this issue as well as the kind of supports that are available. So Janika actually leads these efforts, and she coordinates that with all of our staff, their time to see who's available. And part of folks' job description is to get out there and not only go door to door in our community, which we do, and distribute information very methodically, street by street by street, but also, by the way, when there's a major incident in the city of Hartford, rather unfortunately in a case of a homicide or another violent crime, what we typically do is we like to blanket that particular geographic area or that street or the surrounding streets to make sure that those who have been chronically exposed or exposed to that violent crime in that neighborhood or on that street, we share. You see a flyer here, trauma symptoms. We basically share information on the impact this can have on a person or their child, and then also how they can connect with us to get services. And so you see those two flyers there, the Hartford Care Response Team one, as well as the trauma symptom. That's one example of some of the information that we distribute so that people begin to recognize that they do have supports in the community. So Janika actually leads those efforts. Next slide. And here you just have a few examples of, in fact, we have an upcoming youth summit. We have a leadership academy that actually examines the issues around violence and trauma and education and other challenges that young people are faced with. And they come up with their own recommendations on how these issues can be addressed. One of which is, again, victimization as it relates to crime victims being victimized, and recommended ideas they have that they recommend to not only us as providers, but also the policymakers. And so this coming Saturday, April 29th, here at our location, this will be the 5th annual youth summit that is developed by young people. The presentations are by young people. And oftentimes these are done in concert with lawmakers. You may have heard me mention a couple of years back, we actually had them down in the Library of Congress presenting their recommendations to our congressional delegation, but they've done it many times with our state delegation as well. And this upcoming new Secretary of State will actually be one of the presenters at this youth conference here at 2550 Main Street. Then, of course, I mentioned our 25th year anniversary gala that's going to take place, supporting the work that we've been doing for that period of time. Next slide. That's it. Okay, thank you, folks. Any
Thank
questions?
you so much for this presentation. I think it goes without saying, everyone here is so appreciative of the efforts, not only to make a concise presentation to this council, but it also reflects the committed work that you're doing in the community, and we're certainly grateful for that. Does anybody have any questions for Andrew or his staff? I have one. Are you seeing any outcomes from the New Visions collaboration? I know it's new.
Yeah, I think the biggest outcomes that we're having, at least for right now, is that young people who had typically, they didn't realize that the support was available to them in terms of what we were able to bring. They, in fact, they even articulate that almost weekly, that they didn't realize there was really people that they can talk to, because schools such as New Visions, quite frankly, didn't have the supports up until now. And the young people felt that. They also felt that what we're able to provide them, because they come from schools where there's like 600 and 800 students. This school is only 90 to 100 students. And so the kind of one-on-one attention that we're able to provide them, that personalized attention, is what resonates with them. And that to us let us know that we were in the right place, and that, this is making the difference to the students and their families.
And I'm not sure whether I saw it, but what's the age group that you're working with?
It's actually middle and high schoolers. It's actually middle and high schoolers, 7th through 12th graders.
Okay. Are there any other questions? Don't see any. Thank you again.
Thank you.
As we move on, we have agenda item 6, the VOCA funding update.
Yes, hello everyone. I can give you a quick update on where we stand with the VOCA funding. The director for the Office of Victims of Crime gave her monthly update, and these numbers are through February 28th, which is 5 months into the federal fiscal year. Deposits through that time are $544 million into the Federal Crime Victims Fund, and the fund balance as of February is $1.9 billion, which happens to equal the appropriation for the federal fiscal year 23 grant authorization. So basically the collections that come in for the remaining 7 months of the year will help to replenish the fund balance for federal fiscal year 24. On April 6th, they released the 2023 grant solicitations for victim assistance grants. Connecticut's award is $14.7 million, and that represents a 5.6% reduction from the prior year. And we also learned that the president's fiscal year 24 budget request included an appropriation of $1.2 billion from the Federal Crime Victims Fund, which represents a 37% decrease from what was released in 2023. So the VOCA Fix Act, while stabilizing some revenues, hasn't resulted in the increase. So we're still looking at decreases going forward. Senate Bill 5 that Jerry mentioned earlier includes 2 appropriations, one for fiscal year 24 of $13.1 million from the general fund for OVS to supplement reductions in VOCA, and for year 2, $20 million from the general fund. to help offset VOCA reduction. So we will wait to see if the budget passes, to see if that bill passes, to see if that funding actually makes it to us. And we'll keep you posted. Hopefully we'll know something at the next council meeting in June. Thank you.
Thank you. Any questions? Hearing none. Do we have any new business to address or discuss? I do think we had a very robust meeting. I think we all learned a lot. I know I did. Mary, it looks like you have something to address.
Thank you. Just very quickly, I wanted to note National Crime Victims' Rights Week is coming up, and that the Office of Victim Services is very grateful to all of our VOCA contracted providers who have graciously agreed to present about their programs and services during a contractor spotlight presentation that will be occurring during the week. More information about that will be forthcoming. We also are undertaking a mailing to all of Connecticut's towns and municipalities to provide information about programs and services to the Human Services Department in each town and municipality, or the equivalent of the Human Services Office. And we also will be utilizing the Judicial Branch website and their Twitter account to promote National Crime Victims' Rights Week as well. So just wanted to share that. Thank you.
Thank you. Anybody else? All right,
just wanted
our
to-
next meeting is Tuesday, June 13th at 3 p.m. So make sure your calendars are marked. We hope to see everyone who's here today on that day and time, as well as those who are not here today. I don't think we have any other business. So nice to see all of you. We'll see you in June. The motion to adjourn.
This is Debbie, motion to adjourn.
Second,
Second.
all in favor?
Aye.
Aye. All right. Thank you, everybody.
Thank you.
Thank you.
Bye, thank you.
Bye.
Take care.